What if the most dangerous health crisis happening in your body right now isn't something you can feel, isn't causing pain, and isn't showing up in the way you expect it to? What if I told you that millions of people are experiencing a silent deterioration happening at the cellular level, where their metabolism is gradually breaking down, their energy is slowly draining, and their risk for serious disease is quietly climbing, yet they have no idea it's happening? What if the real issue isn't that you need more complicated treatments or expensive interventions, but rather that you've been given incomplete information about how your body actually works? Welcome to the Healthcare Workshop. I'm Dr. William, and over the next 30 minutes, I'm going to walk you through something that most standard medical education never properly addresses. This is about metabolic health, cellular energy, and the specific mechanisms that determine whether you're going to experience vitality in your later years or find yourself struggling with the chronic conditions that affect so many people today. Let me start with something that might surprise you. The majority of people walking around today, particularly those over 45, are experiencing what researchers are now calling metabolic dysfunction. This isn't a formal diagnosis in most cases. Your doctor probably won't call it that. But what it means is that your cells aren't efficiently converting the food you eat into usable energy. Your insulin signaling is becoming impaired. Your mitochondria, which are the power plants of your cells, are becoming less efficient. And perhaps most importantly, the inflammatory processes in your body are beginning to spiral. Now, here's what's really important to understand about this. Metabolic dysfunction isn't just about weight gain, although that's often a symptom. It's about the fundamental efficiency of every system in your body. When your metabolism starts to fail, everything downstream suffers. Your brain doesn't get the stable energy it needs, so you experience brain fog and memory issues. Your cardiovascular system becomes stressed because your body is constantly in a state of low-grade inflammation. Your joints begin to deteriorate faster. Your skin ages prematurely. Your energy crashes throughout the day. And underneath it all, your risk for type 2 diabetes, heart disease, Alzheimer's disease, and numerous other chronic conditions is climbing steadily. The reason I'm starting with this particular topic is that metabolic health has become the foundational issue of our time. It's the central mechanism that determines health span, lifespan, and quality of life. And here's what makes this both frustrating and exciting. Most of this is preventable. Most of this is reversible. Most of this can be addressed through specific understanding and specific action. But it requires that you think about your body differently than you've probably been taught to think about it. You've likely been given advice about calories and exercise and willpower. And while movement and food choice absolutely matter, they matter in a context that most people don't fully understand. That context is metabolic capacity, your body's ability to efficiently process energy, repair itself, and maintain stability. Let me walk you through what's actually happening inside your body as your metabolism begins to shift. Around the age of 30, your metabolic rate naturally begins to decline slightly each year. This is not catastrophic, but it's real. Simultaneously, insulin resistance typically begins to develop. Now, insulin resistance is one of the most important concepts in modern health, and most people have never really had it explained to them properly. Here's what it means. Insulin is a hormone that your pancreas produces in response to blood sugar elevation. Its job is to signal to your cells to take glucose out of the bloodstream and use it for energy or store it. When this system works properly, blood sugar comes up, insulin does its job, and blood sugar comes back down. This is healthy. This is normal. But when you consume a diet that's predominantly processed carbohydrates, refined sugars, seed oils, and ultra-processed foods, something starts to happen. Your cells begin to become desensitized to insulin signal. It's like if someone keeps shouting at you. Eventually, you stop responding as readily to the sound. Your cells do the same thing with insulin. They become less responsive. So your pancreas has to produce more and more insulin to achieve the same effect. This is insulin resistance, and it's where most of the modern chronic disease epidemic begins. What this creates is a vicious cycle. Your blood sugar becomes more dysregulated. You experience energy crashes. You crave more refined carbohydrates to feel better. You eat them. Your blood sugar spikes again. Your insulin goes even higher. Your cells become even more resistant. And this cycle perpetuates. Over months and years, this constant elevation in insulin and blood sugar dysregulation begins to damage virtually every system in your body. It accelerates aging at the cellular level. It increases inflammation throughout your tissues. It damages the lining of your blood vessels, setting the stage for cardiovascular disease. It impairs your liver's ability to process toxins. It disrupts your hormonal balance. It accelerates cognitive decline, and it makes weight management nearly impossible, because high insulin levels signal your body to store fat and prevent fat burning. Now, here's where the conversation becomes really important. The standard medical response to this problem has historically been to wait until the insulin resistance becomes severe enough to be called type 2 diabetes, and then to prescribe medication to manage blood sugar. But this approach misses the entire upstream opportunity. By the time someone is officially diagnosed with type 2 diabetes, they've often had insulin resistance for 10 to 15 years. The damage has been accumulating, the inflammation has been worsening, the cardiovascular risk has been climbing, and while medications can certainly help manage blood sugar in the short term, they don't address the fundamental problem, which is the loss of metabolic capacity. The real solution is to restore metabolic function before it deteriorates to the point of disease diagnosis. So what does restoring metabolic capacity actually look like? It starts with understanding that your body responds to the specific types of food you eat, the timing of when you eat them, the quality of your sleep, the amount of movement you're getting, and your stress levels. These aren't separate variables. They're all interconnected. They're all driving your metabolic capacity up or down. Let me break down the most critical factors. First is food quality and composition. The most important concept here is that not all calories are equal. 100 calories from refined white bread and 100 calories from wild salmon are not the same inside your body. The salmon provides stable energy, doesn't trigger an insulin spike, delivers essential nutrients, and supports metabolic health. The white bread creates a rapid blood sugar spike, triggers a large insulin response, and leaves your energy crashing 30 minutes later. This is why the conversation about calories is incomplete without the conversation about food quality. The foods that most efficiently restore metabolic capacity are whole foods that your great-grandparents would recognize as food. Protein from clean sources like fish, grass-fed beef, pasture-raised chicken, and eggs. Healthy fats from sources like avocados, nuts, seeds, wild fish, and olive oil. Vegetables, particularly the colorful ones that are rich in phytonutrients and fiber. Whole fruits in moderation, particularly berries, which have a lower glycemic load. And minimal consumption of ultra-processed foods, refined carbohydrates, and sugar. The second critical factor is meal timing and composition. Your body doesn't process food randomly throughout the day. It processes food in response to circadian rhythms. Your cortisol rises in the morning, which makes your insulin sensitivity better and your metabolism more efficient. Your insulin sensitivity gradually declines throughout the day. This means that a particular meal composition that your body handles well at breakfast might create a significant blood sugar dysregulation if you eat that same meal at 9 in the evening. This is why when you're working to restore metabolic capacity, the timing of your meals becomes as important as their composition. Most people benefit from eating their largest meals earlier in the day and their smallest meals in the evening. Most people benefit from having some consistency in their eating windows and not constantly grazing throughout the day, which keeps insulin chronically elevated. And most people benefit from including adequate protein at every meal because protein has the lowest insulin response of any macronutrient, and it's essential for maintaining muscle mass, which is a crucial driver of metabolic capacity. The third critical factor is sleep quality. Sleep is where your body does most of its repair work. When you sleep, your body produces growth hormone, which is essential for rebuilding tissue and maintaining muscle. Your brain clears metabolic waste products. Your immune system resets. Your hormonal balance recalibrates. But when you're getting insufficient sleep or poor quality sleep, all of this repair is compromised. You wake up with elevated cortisol, your hunger hormones become dysregulated, your insulin sensitivity decreases, your metabolic rate drops, and your body begins to store fat more readily. In our modern world, most people are sleeping less and more poorly than any population in human history. We're exposed to artificial light at night, which suppresses melatonin. We're exposed to the stress and stimulation of screens right up until bedtime. We're consuming caffeine too late in the day. We're going to bed with elevated cortisol and elevated heart rate, and we're waking up throughout the night. This chronic sleep deprivation is one of the most significant drivers of metabolic dysfunction that we're seeing today. If you want to restore metabolic capacity, sleep quality has to be a priority. The fourth critical factor is movement and muscle mass. Your muscles are incredibly metabolically active tissue. They're constantly burning calories, even at rest. They're sensitive to insulin. They're a storage site for glucose. When you're building and maintaining muscle mass, you're directly improving your metabolic capacity. But the modern sedentary lifestyle means that most people are losing muscle mass starting in their 30s. They're doing nothing to counteract this. The standard advice of going for a walk or doing moderate cardio is not sufficient to maintain muscle mass as you age. You need resistance training. You need to be lifting heavy things, challenging your muscles, creating the stimulus for them to grow and adapt. This doesn't mean you need to become a bodybuilder. It means that several times per week, you need to engage in resistance training that challenges your major muscle groups. This could be weightlifting, it could be body weight resistance exercises, it could be resistance bands. The specific modality matters less than the consistency and intensity, but this component is essential for metabolic restoration. The fifth critical factor is stress management and nervous system regulation. Most people are chronically stressed. They're in a constant state of sympathetic nervous system activation. This means they have elevated cortisol, they have elevated adrenaline. Their body is in a fight or flight state. In this state, your body doesn't prioritize long-term health and repair. It prioritizes immediate survival. Your metabolism shifts to prioritize quick energy production rather than efficient energy management. Your insulin sensitivity decreases. Your blood sugar dysregulation worsens. Your inflammation increases. And your body holds on to fat because from your nervous system's perspective, you're in a threatening environment. Restoring metabolic capacity requires that you actively regulate your nervous system. This could be through meditation, it could be through breath work, it could be through time in nature, it could be through yoga, it could be through cold exposure or heat exposure, it could be through massage or other forms of body work. The specific modality matters less than the consistency, but you need to have practices that are actively calming your nervous system and shifting you toward parasympathetic activation, where your body feels safe and can prioritize healing and repair. Now let me bring all of this together and talk about what the actual protocol looks like for someone who wants to restore metabolic capacity. The first step is assessment. You want to understand your current state. This means getting blood work that looks at metabolic markers. You want to know your fasting glucose. You want to know your fasting insulin. You want to know your C-reactive protein, which is a marker of inflammation. You want to know your triglycerides and your cholesterol ratios. You want to know your HbA1c, which tells you your average blood sugar over the previous 3 months. You want to know your vitamin D level. You want to know your magnesium status if possible. These markers give you a baseline and they help you understand where your metabolic dysfunction is most pronounced. The second step is dietary intervention. For most people, this means reducing refined carbohydrates and sugar significantly. It means increasing vegetable intake, particularly non-starchy vegetables. It means including adequate protein at every meal. It means shifting to healthier fats and away from seed oils and processed fats. It means eating most of your food in a 4 to 8 hour window rather than grazing throughout the day. It means removing ultra-processed foods. This isn't complicated, but it is different from what most people are doing. For many people, their food environment is the primary driver of metabolic dysfunction, and changing this is transformative. The third step is movement. You want to be including resistance training several times per week. You want to be moving throughout the day in general. This doesn't mean you need to do intense cardio. In fact, excessive cardio can sometimes be counterproductive to metabolic restoration. But you want to be active. You want to be building and maintaining muscle mass. The fourth step is sleep optimization. This means setting a consistent sleep schedule. This means eliminating artificial light in the evening or wearing blue light blocking glasses. This means stopping screen exposure an hour before bed. This means creating a cool, dark sleep environment. This means potentially using supplements that support sleep, like magnesium or glycine. This means addressing any underlying sleep disorders like sleep apnea. Sleep quality improvement often creates more metabolic benefit than any other single intervention. The fifth step is stress management. This means finding practices that work for you and committing to them consistently. This means potentially working with a therapist or coach to address sources of chronic stress. This means setting boundaries around work and other obligations. This means prioritizing relationships and community. This means engaging in activities that bring you joy. Now I want to talk about something that's really important, which is the role of chronic inflammation in metabolic dysfunction. Inflammation has become one of the central mechanisms of virtually all chronic disease. We know this from research. When your body is in a chronic inflammatory state, everything goes wrong. Your immune system becomes dysregulated. Your metabolism becomes impaired. Your cardiovascular system becomes inflamed, which increases your risk of heart attack and stroke. Your joints become inflamed, which causes pain and accelerates degeneration. Your brain becomes inflamed, which accelerates cognitive decline and increases your risk of neurodegenerative disease. Your gut becomes inflamed, which impairs nutrient absorption and further disrupts your metabolism. The standard medical approach to inflammation is to use anti-inflammatory medications like NSAIDs or biological immunosuppressants. But these medications come with significant side effects, and they don't address the root cause. The root cause is usually metabolic dysfunction, poor food choices, inadequate sleep, chronic stress, lack of movement, and intestinal permeability or leaky gut. Restoring metabolic capacity and reducing inflammation means addressing all of these factors. It means eating food that reduces inflammation, which is primarily whole food that's rich in phytonutrients and fiber. It means avoiding foods that increase inflammation, which is primarily ultra-processed food, refined carbohydrates, seed oils, and sugar. It means getting adequate sleep. It means managing stress. It means moving regularly. It means potentially healing your gut with anti-inflammatory foods and specific supplements if needed. When you address all of these factors, the inflammation in your body begins to decrease. Your pain decreases, your energy improves, your mental clarity improves, your body composition changes for the better, your cardiovascular risk decreases, your risk of chronic disease begins to reverse. This is real, this is science-based, this is actionable, and this is available to you. One more thing I want to emphasize is the concept of metabolic flexibility. This is the ability of your body to efficiently switch between burning carbohydrates and burning fat for fuel. Most modern people have lost metabolic flexibility. Their bodies have become dependent on a constant supply of glucose. They can't efficiently burn fat. This means they crash when they go a few hours without eating. Their energy is unstable. Their weight management is difficult. But metabolic flexibility is something you can restore. It comes through consistent practice of eating in a way that allows your body to use fat as fuel. It comes through periods of fasting, which challenges your body to burn fat stores. It comes through exercise, particularly resistance training and some forms of cardiovascular work. When you restore metabolic flexibility, your energy becomes stable, your hunger becomes manageable, your body composition improves, and you've essentially given yourself more options for how you fuel your body. I want to take a moment here to connect with our community. If you're watching this and you found value in this explanation of metabolic health, please engage with this content. Drop a comment and tell me what aspect of your metabolism you're most interested in learning more about. Are you struggling with energy? Are you dealing with weight management challenges? Are you trying to prevent chronic disease? Are you interested in optimizing your performance? Your questions help me understand what content will be most valuable for you. If you're new to this channel, please subscribe. We create evidence-based content about health and longevity every single week. And if you enjoy this content, please share it with someone in your life who you care about. Health information is too important to stay isolated, and the more people who understand how their metabolism actually works, the healthier our communities will become. I also want to encourage you to take action on what you've learned today. Don't just watch this video and do nothing. Pick one thing, just one thing. Maybe it's improving your sleep by going to bed 30 minutes earlier. Maybe it's adding resistance training to your week. Maybe it's reducing your sugar intake. Maybe it's starting a meditation practice. Pick one thing and commit to it for the next 30 days. Notice what changes. Notice how you feel. Notice your energy. Notice your mental clarity. The science that backs up what I've shared with you today is real and it works. Your body wants to be healthy. Your body wants to have energy. Your body wants to function optimally. It's just waiting for the right signals and the right environment. In conclusion, metabolic health is the foundation of everything. It's the foundation of how you feel day to day. It's the foundation of whether you develop chronic disease. It's the foundation of whether you age with vitality or decline with frailty. And the beautiful thing about metabolic health is that it's responsive. It changes based on your choices. Every meal you eat is sending a signal to your body about whether you're supporting metabolic capacity or undermining it. Every night of sleep is either restoring your metabolism or further impairing it. Every workout is either building metabolic capacity or not. Every moment of stress you experience is either dysregulating your metabolism or you're managing it effectively. You have more control over your metabolic health than you've probably been told. The information is available. The science is clear. The pathway forward is visible. It just requires commitment and consistency. It requires that you think about your body as a dynamic system that's responsive to your choices rather than a static thing that's fixed and unchangeable. Because it's not. Your body is constantly changing. Every single cell in your body is being replaced. You're literally building a new body all the time. The question is whether you're building it in a direction of health or disease, whether you're building it in a direction of vitality or decline, whether you're building it in a direction of longevity or premature aging. I know which direction I want you to build in. I hope you do too. Thank you for spending this time with me today. Thank you for taking your health seriously. Thank you for being part of this community. I'm committed to bringing you evidence-based health information that you can actually use. Subscribe, engage, share, and most importantly, take action. Your health is worth it. Your future is worth it. Now go out and start restoring your metabolic capacity today.